Let's take you back to KwaZulu-Natal now, where unemployed doctors marched to Premier Ntuli's office in Pietermaritzburg over unfulfilled promises of new posts. In June, Health MEC Nomagugu Simelane promised to make at least 20 new posts available to address the pressing issue of unemployment among medical doctors and health professionals in that province. Newzroom Afrika's Mthembu is following that story for us and joins us now live. Now, Phila, one of the compelling arguments that were made for the budget of health not to be scaled down, in fact, for even initiatives to ensure that more money is made available was, among others, the fact that doctors and, of course, other health professionals had to be employed, and the fact that we actually need more of them and certainly not less. What's happening in KwaZulu-Natal?
Indeed. So, Vuyo, we are coming to you live outside the Premier's offices, and this is where quite a number of the unemployed KZN doctors had been demonstrating a picket. They were expecting to hear from the KZN Premier, Thami Ntuli, to actually come out and address them. However, we did see the KZN Health MEC Nomagugu Simelane come out from an executive council meeting, which was happening inside with the Premier, come out here now to actually speak to these doctors. So from the conversation that we picked up that the KZN Health MEC had with these unemployed doctors, because they had quite a number of questions, especially around the 20 vacant posts, which were promised by the KZN Health Department at around June as they continue to fight for employment. So I'm going to take you back in June when they had staged a very similar picket. The KZN Health MEC came out and addressed these unemployed doctors, saying that there's going to be 20 vacant posts which are going to be advertised in 7 days back then, and we understand that these vacant posts were in fact advertised, but now these doctors were complaining, saying that they do not know or heard of any progress. They haven't heard of any shortlisting. What is the progress when it comes to that? Because they have reached out to the KZN government, but they were met with silence, Vuyo. So the MEC came out and said, when it comes to those particular vacant posts, they received over 1,900 applications, but only 20 vacancies were available, saying that come Friday, they will then be starting with the shortlisting. So what they have been doing is that they have been conducting a vetting process to determine if the applicants have worked, at any health facility, or that they are in fact currently employed. So from here, then we can expect for a short listing to happen. But also what she told us is that next week, following this council meeting that they had today, they have decided that come next week, they will then make available 100 vacancies, and they will be communicating that obviously in due course, and how they may encourage unemployed doctors to go on about applying for those particular vacancies. So the challenges around that are still quite a lot, as we also heard from the doctors that we spoke to, saying that, what also concerns them is that there are people who are still at medical school and they are going to be graduating at some point, adding to the high number of the already, concerning high number of unemployed doctors here in the province. And during that engagement, we obviously did catch up with the KZN Health MEC Nomagugu Simelane, who also acknowledged that the shortage of doctors at health facilities is quite a challenge that needs to be addressed, but they are doing all they can at this particular time. Let's take a listen to what she had to say.
Well, we've always said that the vacancy rate of doctors and nurses, by the way, because it's not just doctors, is high, and it makes working extremely difficult for those that are in the system. So yes, we do have that challenge, and that is why we're the ones who are champions and championing this on behalf of the unemployed doctors and unemployed nurses, because we also have those.
And obviously from that conversation, it goes to show that there is a lot that needs to be done, and the shortage of medical staff is a big issue. We were able to also speak to one of, the community members, residents here, who was headed to a clinic for some medical attention, saying that they fully support the pickets which was actually staged by these doctors, and they call to have job opportunities available to them, as already these health facilities are facing a number of challenges. They have been saying to us that in some instances it had gotten to a point where they would have to wait in queues for hours before they are seen by a doctor, and that should more doctors be hired, then this kind of a burden will be a thing of the past ultimately.
Phila, with that update there, speaks really to the unemployment crisis in this country. 20 posts available, what you're talking about, more than 100 applications, and that's just KZN alone. And if you cast your mind back to about a month ago or so, I mean, there were far more than 900,000 applications for police jobs, 5,500 vacancies that are available in the South African Police Service, but you had far more than 900,000 people applying for those jobs. A crisis we have in our hands, indeed.